But first, we are going to be speaking to Iran's health minister, Ali Jafarian, who's the deputy health minister, in fact, joining us from Tehran now to get an update on the casualty figures after 9 days of war. Minister, thank you very much for joining us on Al Jazeera. It's been 9 days now since the conflicts began, since the attacks, the US-Israeli attacks began on Iran. Can you give us an update on the casualties, the number of people killed and injured in these past 9 days?
Yeah, good day. Thank you for the time. I can very briefly introduce to you what has happened in the past 9 days. We have had more than 12,000 people wounded and 1,255 people killed, aging from 8 months to 88 years old. 200 of those people who were killed are women, and 200 are less than 18. And as everybody know, 168 children were killed in the Minab Elementary School. We have 55 healthcare workers wounded and 11 killed, including 4 physicians, 2 nurses, and 3 emergency workers. 29 clinical facilities are damaged. 10 out of them are, inactive now, and we have to evacuate the patients from other 7 centers, hospitals in the country. We have more than 200 cities involved by the attacks from the United States and Israeli regime. We have had 52 health centers damaged, 15 ambulances, and 18 pre-hospital emergency service damaged or destructed till now.
Minister Jafarian, as you know, the Israelis and Americans say that they've been targeting military sites, mostly military installations. But can you tell us how many civilians in all? You mentioned the number of women and children killed, 200, I think you said. Out of the 1,000 of people, more than 1,000 of people killed in these 9 days, how many civilians? Because the Israelis and Americans insist that they're only targeting military installations.
No, as I said, most of these 1,255 people who were killed are not military. They are civilians. They're living in their homes or their workplace, and they are injured by the attacks because many parts of the cities are attacked. Not all are military bases. There are some in neighborhoods, and most of these people are not military. Most of them are civil people.
Are hospitals in Iran right now, whether in the capital Tehran or elsewhere, are they able to treat the injured people?
Yeah, all of our hospitals are working, except that 29 hospitals that are damaged and could not work anymore. But the other hospitals are serving the people. My colleagues in all around the country are at their work, and they are covering every need, every emergency need that is needed. And also in many cities, some elective surgeries are going on, and the health service, both in primary health care and in the hospitals, are active now.
The injuries that people have sustained, what type of injuries are they? And what have people died of in these attacks?
Most of the people who have died, are from the explosion itself. But the injured people who are transferred to our facilities mostly have 2 types of injuries. One is the burns, and the other one is the crash injuries. So this is the main reasons for the injuring people in the country, and according to the attacks.
We saw a thick plume of black smoke over Tehran on Sunday after an oil refinery was attacked. What impact is that having on the population, on the population's health?
On Saturday night, we had 3 strikes in 3 corners of the Tehran. The Tehran is a city of 9-10 million population. And on the Sunday morning, the sky was black, and there was acid rain in Tehran. That may cause some respiratory problems for those, especially those who are at risk, like elderly and kids. And the whole city was dark till the afternoon yesterday. It also have some bad effect on the soil because this acid rain will go to the soil and makes this polluted. Still, there is the huge dark cloud from these three corners in the city, and this is not a military, as you know, this is not a military target to be attacked.
Well, so what recommendations are you making to citizens as a result of this pollution?
The main recommendation was that everybody who cannot, who is, it is possible for them to stay at home, closing the, all of the windows, and if they have to go out of the home, they use masks. Those who are at risk do not do that, and until the pollution is clear from the sky.
Deputy Minister, how well prepared is Iran's health infrastructure, its health facilities, if this conflict drags on and the casualties continue to rise?
I think our, health system is as enough strong as is needed for the country's needs. And we have a very good structure of health system across the country. We have medical universities who cover both health and education. So in each province, we have the system by itself is working independently if needed. And the Ministry of Health is, supporting them and covering all of the needs. We are trying to, to have drugs and medical equipments in spite of the severe sanctions against our country, which makes some problems. But still, we are working with that, and we have the way to import what is needed from outside. Our pharmaceutical companies are working. They are producing the drugs that is needed for the country. So I think we have as much resilience as we need for these attacks if it's be longer, but I hope that would not be so.
All right, Dr. Ali Jafarian, thank you very much for talking to us from Tehran. Dr. Ali Jafarian is Iran's Deputy Health Minister, joining us from the Iranian capital there.